My name is Judy. I'm a 62-year-old woman. I live in the Midwest. And tomorrow I will have a laminectomy and spinal fusion in my lumbar vertebrae. My doctor's not sure exactly how far up he's going to go. It could be just 3 or 4 inches, or it could be up to close to 8 inches. I have scoliosis in addition to severe spinal stenosis. I also have in my L3, L4 vertebrae a bony spur that is digging into the nerve roots that originate there. And so I've had significant pain in my right leg for the last 4 years, and I've had a lifetime of lower back problems, but the pain that has prompted this surgery has gotten worse in recent months, and I'm looking forward to being without that constant companion that I've had for a long time. Most people that I know who have had the surgery say that even though the pain after surgery is intense, to be rid of that other pain is such a relief. And I'm praying that that is going to be the case for me. We're staying in a hotel. My husband is with me, and my daughter will be joining us tonight. She lives about 30 miles away, and they will be with me tomorrow waiting while I have my surgery. I've been looking forward to this somewhat. I have trepidation because I don't know what to expect exactly, but I have faith that this is going to be an answer to a long time concern for us, and that my quality of life will be better after this and after the recovery. I'm doing this because it was hard for me to find information for women my age on what to expect, and just the after effects of the surgery. I'm not going to go into a lot of unnecessary detail, but just try to make this as helpful to you as possible. I don't know exactly what caused my problems. They're all in my lower back area, but I did, when I was 20 years old, had an escalator accident, and at the bottom of an escalator a woman fell backwards on me, and the steps continued to grind into my back until someone pressed the emergency stop button. And so I've always wondered if that isn't the root cause of my problems. I do have a lot of burning pain in my lower right calf area. It just stops there. It doesn't go down to my foot. I know a lot of people have pain and numbness in their feet as well. This is all on my right side. I don't have anything on my left side. I had that burning calf pain for several years, and then it started to become more complicated with the addition of sciatic pain in the back, and with pain in my hips and knee and thigh, and then in the last several months I've had the addition of pain in my pelvic area, in my groin. So I'm really looking forward to getting rid of that pain. Tomorrow my surgeon will be, as I said, doing a laminectomy and a spinal fusion with rods and screws. Instrumentation, I think, is the proper way to say that. He also will be straightening my spine, and that is the question as far as how high up to go, because my spine is crooked higher than where the stenosis is, and so he is going to decide, I'm sure he has by now decided how far up he's going to go. It will of course have an impact on my flexibility and things like that, so I'm praying that it can be a shorter as opposed to a longer rod or rods that will be in there, but we're just confident that he knows what he's doing and he'll do the right thing. This has had a tremendous impact on the quality of my life over the last few years. I haven't been able to do things that I would have done everything. I was telling my daughter the other day that every place I go, I do it with the idea of where will I be able to sit if I can't stand very long, or if I can't walk more than a block or two without sitting down. I need to know that there's going to be a place where I can do that. I'm really looking forward to being able to walk distances after this. They are expecting me to be able to walk 1 mile after the first month, and 2 miles after the second month, and I can't tell you how much I'm looking forward to that. The surgery, we don't know exactly how long it will take. It may be between 5 to 8 hours tomorrow. We have to be at the hospital at 5:30 a.m. I've been given some antibacterial soap to take a shower tonight with, half of that, and then tomorrow with the other half before we go to the hospital, and instructed to put on clean pajamas and sleep on clean sheets tonight, and as I said, that won't be a problem. We're in a hotel, and so we're ready for that. We are just about a mile from the hospital, and so we'll be heading over there at 5:30 in the morning.